the most common things I see, especially with women, are recurrent urinary tract infections. By the time they come to us, they've usually tried and failed to treat the infection a couple of times. We would consider a recurrent urinary tract infection to be 3 or more infections within a 12-month period. Primary symptoms of a UTI for most women would be pain, burning, blood, frequency, urgency. In elderly patients, we also tend to see altered mental status or confusion. So if you have a patient that's of a certain age and they're acting very confused and it's all of a sudden and there's no explanation for it, we tend to be very proactive with checking for a urinary tract infection. Treatment-wise, we start with antibiotics, try to get a culture, figure out exactly what we have growing so we can specify the antibiotic to the bacteria, make sure it's not resistant to it. For men, as opposed to women, men tend to have an underlying medical condition when they have recurrent infections. They tend to have bladder outlet obstruction where they can't empty their bladder as well. Women are the ones that are kind of a surprise. You never know exactly what could be causing it, and treatment for them is a little bit different than men. With men, we try to treat the underlying condition and help get them to empty their bladder better. With women, it's going to depend on a few different things, whether or not they're peri or postmenopausal. If so, then we would start them on a vaginal estrogen cream to help replenish the moisture and help return the body's natural flora to fight the bacteria. Also with women, after they've tried a few different antibiotics and we've gotten it under control, putting them on a low-dose prophylactic antibiotic for a month or longer can sometimes help prevent that bacteria from returning. If urinary tract infections are not treated in enough time, it can absolutely progress into something more, something pyelonephritis or an infection of the kidney. It can cause all kinds of other problems, sepsis, issues that would only really be able to be treated in the hospital setting, emergency room situation. Ways to help prevent urinary tract infection. Hydration is key. Always hydration. It helps to flush out your kidneys, flush out your bladder, allow everything to kind of stay nice and clear. Cranberry juice is great for urinary tract health. If not in juice form, you can get cranberry tablets over the counter. Again, vaginal estrogen cream can also help prevent infection because it can help return the body's natural flora, which helps fight the bad bacteria. Ways to help determine whether or not you're having a kidney stone versus a urinary tract infection would be to come into the office. We would test your urine. When we test your urine with the dipstick test, we would determine if there's blood, leukocytes, or white blood cells, and if there's nitrates. Nitrates are a pretty definite positive that it's an infection versus just a kidney stone.